Hello, hi, welcome to Girls Night in Rejuva. And I wanted to share with you a presentation on feminine rejuvenation. Let me open my screen here. I'm Marianne Woody, a nurse practitioner, and the topic of my presentation is latest developments in feminine rejuvenation. So I wanted to let you know a little bit about me, that I've been a nurse practitioner from the University of Pittsburgh. And while I've been a nurse for over 30 years, about 22 years ago, I became a family nurse practitioner. Initially worked in family practice in ER, where I did many gynae exams. About 13 years ago, I became passionate about dermatology, and I trained as a dermoscopy expert for early skin cancer identification. And because I'm an educator, I believe in certification, and I'm certified in dermatology. So the last 7 years, I became heavily involved in aesthetics through my work at Juva. And I've been a laser expert, writing the book on energy-based devices at Juva. As a certified aesthetic nurse specialist, I wrote a clinical manual for all the uses, so I'm familiar with everything. I am one of the first practitioners to say that I'm trained in vaginal rejuvenation. So it's been a continuous learning in the ever-changing field, and I hope I can educate you about feminine rejuvenation. So let's start feminine rejuvenation by describing the definition. It's a range of aesthetic and functional procedures in the feminine genital region. We correct and restore the optimum structure form of the vagina and surrounding tissues. We improve the function, the hydration, and elasticity of the vaginal mucosa. Why is this important? Because women's intimate health and quality of life are really tightly associated to function. So we can have loss of self-confidence, reduced exercise participation, loss of sexual interest or desire, or disturbed interpersonal relationships. So what do we define as the problems of feminine and offer rejuvenation? The problems are either in that area, vaginal or urinary. So think of the vaginal concerns can be atrophic, which is like tightening, or laxicity, which is loose. And then infections can develop as well with this maltreatment or malfunctioning mucosa. The urinary symptoms can be incontinence or infections. So atrophy, what does atrophy mean? It's also called atrophic vaginitis. It occurs with decline of estrogen production, mostly often after menopause, but it can be perimenopausal before the year, which could be years, 10 years before menopause, or during even early with breastfeeding fluctuations of hormones. Vaginal health is really connected to urinary health. Vaginal laxicity is defined as looseness within the vagina. It's associated with a number of pregnancy women has had, vaginal deliveries, or just weight fluctuation back and forth can create laxity. And the extreme form of this laxity is pelvic organ prolapse, either rectocele, cystocele, or uterine prolapse. What that means is that these organs can actually fall out of the areas where they are. And I've seen that many times in my career as a nurse practitioner over 30 years. So what are the vaginal signs and symptoms? Atrophy, we see vaginal dryness, burning, general itching, problems of intercourse, either light bleeding or painful sex. When in contrast of laxity, We have loss of interest or diminished sensation, and the extreme being organ prolapse. We might have pressure or like difficult elimination. I've know some women that can't have a bowel movement until they put their hand in their vagina to like limit the bulge that's occurring in their area. Some urinary signs and symptoms. As I said, urinary symptoms occur whether somebody has atrophy or laxity. You could have more urinary tract infections. You could have urinary incontinence, involuntary leakage of urine, stress-induced urgency, frequency, or burning. Some vaginal atrophy I could see as a clinician. On the left, I see a healthy introitus or vaginal area. And on the right, we see atrophic vaginitis with loss of the labia and some patchy redness that is quite tender. I want to just go back on the history and treatment summary of what we did in the past for urinary and vaginal concerns. There was only surgical repair or non-surgical, and what they did in surgery was often painful and has side effects as its own, having a vaginoplasty, labiaplasty, urethral slings. Non-surgical has always been recommended, either behavioral, PT, pelvic muscle training, pessary, or medication. So what's new is minimal and non-invasive procedures such as radiofrequency and high-intensity focused electromagnetic energy. The RF treatments that we have at Juba are Thermiva or Ultrafem 360 that I want to speak with you about, and the electromagnetic is Emsella. So let me help you understand non-surgical treatments that are done. There are behavioral therapies that involve fluid restriction as well as caffeine restriction for a lot of urinary symptoms. Also, weight loss has been recommended. Pelvic floor muscle training involves Kegel exercise, and I will detail that, and you can see how difficult that might be. PT or biofeedback. And when somebody has the extreme of laxity, vaginal pessaries are a removable device placed in the vagina that looks like a donut, and it's designed to support the areas of the pelvic organ prolapse. I want to explain what is Kegel's exercise. That you find the pelvic muscles used to stop urinating, and you squeeze these muscles like an elevator for like 3 seconds, then you relax these muscles, and then the goal is to consecutively add seconds each week until you're able to squeeze for 10 seconds. And if you try that, it's quite difficult. And you're supposed to, every time you do it, you're supposed to do that squeezing, relaxing 10 to 15 times a day. 15 times per session, and do that at least 3 times a day. So sometimes we tell patients every time they are driving, stopping at a red light, try and do it Kegels at least 10 to 15 times. What's new is this Emsella treatment induces deep pelvic floor muscle contractions to deliver the equivalent of over 10,000 Kegel exercise in a half hour. It's also used for male urinary incontinence and rectal incontinence. And so you see in this diagram the before, during the treatment, and after, how this toning occurs in the pelvic area. And this is just, you can see on YouTube a device pictured of an actual patient having Emsella treatment. It has no time downtime, it has virtually painless. She's just sitting fully dressed on a chair for a half hour, and she could do whatever she wants, like read a paper, do whatever. Some frequently asked questions: how long is the treatment? How many sessions do I need? Well, it's about 30 minutes, and we recommend 6 sessions scheduled twice a week. And what the procedure feels like, is it painful? It's just like tingling and like a contraction of that area of the muscles during the procedure, but no really effects afterwards. You may resume daily activities immediately after the treatment. There's really no downtime. How fast will I see results? Well, some people notice some improvement after the single session, but the results are typically continue to improve over the next few weeks. Moving on to the other new and radiofrequency treatments, we have 2 devices at Juva, ThermEva and UltraFem 360. They're both radiofrequency treatments for vaginal rejuvenation. How radiofrequency works, it's really temperature controlled. And we know to smooth the skin and shrink mucosa, it takes between 42 and 47 degrees Celsius. We tighten the skin immediately and stimulate new collagen. There's no downtime, no pain. We could treat both inside the vagina or outside the labia, and effects last about a year. And we can treat really all ages. So who is the ideal candidate for radiofrequency? Anybody that has loose vagina, loose labia, dry vagina, leaky bladder, orgasmic problems. You should not have this treatment if you have inserted a metal pacemaker or defibrillator or any implant. If you're pregnant, postpone if you're on your period is recommended, and we should wait at least 6 weeks after childbirth. An IUD may or may not be a contraindication. You may have a fever. If you're acutely ill or have a bacterial or active infection, you should wait till you feel better. And if you've taken Accutane or isotretinoin in the past 6 months, you should wait till that is completed. We do not recommend the treatment if you've had radiation in that area or if you have any neuropathy. So ThermEva, switching frequency to radio frequency vaginal rejuvenation. I just want to show you the equipment that's used. We have either a S-shaped kind of handpiece to treat inside the vagina and labia, and the generator is pictured above that is really temperature controlled. It's non-invasive and there's no downtime. This is just to show you a picture of ThermEva treatment. Here we show that same S-shaped applicator treating the outside of the labia and the effects after one treatment. And then we have the treatment inside the vagina. And here you see we treat both all the walls of the vagina, whether it be the top, bottom, and side to side, and the generation of the mucosa that results. So the protocol for ThermEva involves taking pre and post photos if someone desires that. There's no anesthesia. It's about 30 minutes for a full treatment. And we spend about 20 minutes on the inside and 10 minutes on the outside. We recommend about 3 total treatments, about a month apart. One touch-up treatment is recommended either at 6 or 12 months. The just to share with you, Thermiva came based on this clinical study about 5 years ago, and the primary results were for vaginal looseness or laxity. People felt very comfortable, all found significant change. It lasted about 9 to 12 months, and the effects were maintained if somebody had a touch up in 1 to 2 times per year. All of the people in the study recommended. Secondary results, those with atrophic changes became moist and comfortable. Those with mild or moderate stress urinary incontinence were drier. Those with orgasmic dysfunction were able to improve. So this kind of shows you a young 23-year-old with visual show and had discomfort when she exercised because of the shape of her labia. Here's a picture before on the left and after on the right. And this is just a different view at the bottom showing between her legs of her labia and before and after. So some other pictures, if somebody has laxity, it can tighten. And if somebody's atrophic, it can definitely improve. If you look on the right side, the top being before treatment with the patchy redness of erythema, and afterward, the vagina looks more moist, has more normal secretions. And the study on orgasmic function that was done using Thermiva, there was reduced time for orgasm by 1/3 to 1/2. And the majority of women, 23 out of 25, reported a 50% improvement in their intensity of their orgasms. So moving on to just UltraFem 360, another radiofrequency device, and how the apparatus looks. Has 2 different probes for vaginal procedure and 1 for outside vulvar procedure. And what's unique about this FEM 360, this device came a couple years after Thermiva, is the circumferential heating that occurs. So no longer do we need to go at the top, bottom, side. It does all of it all at once. And so that shortens the treatment duration. And you can see how the thickening of the mucosa before and after. So the treatment protocol, as I said, has changed. We do also do treatment photos if desired. There is no anesthesia. It's about 30 minutes per treatment, 8 minutes only on the inside and about 15 to 20 on the outside. It's 3 turtle treatments, 1 to 2 weeks apart, and 1 touch-up is, again, 6 to 12 months, about the same. There, just to show you their study that was done in 2017. As I said, it came at a couple years after the Thermiva. Urinary leakage was improved. In follow-up, everybody felt that the majority, 98% of the patients agreed or strongly agreed that their stress urinary incontinence condition improved. 93% agreed that their gratification during intercourse improved. All subjects reported that they felt either if they were lax, that their perceptions that they were loose or want to move to moderately tight at the 1-month follow-up. And none of the subjects reported dissatisfaction. There was no adverse events recorded. So in summary of the latest developments in feminine rejuvenation, it's an in-office procedure, no anesthesia required. It's virtually painless. The procedure durations, if we're just treating the inside, plus the outside varies from 8 to 30 minutes. There's no downtime, and there's 3 procedures recommended for each at 1 to 4 week intervals. The benefits reported by our patients are vaginal tightening, increased lubrication, improvement in stress urinary incontinence, and more intense orgasms. So when you come to Juva, we do survey your vaginal and sexual health. We ask you about stress urinary incontinence, vaginal dryness, recurrent infections, laxity, and atrophy. And I want to pause a minute by sharing this for, and that is your code word for today, lady parts, lady parts. This is a cover story that I've been so blessed to share with Dr. Katz, and that's myself. And that appeared when we were just the explosion of vaginal and feminine rejuvenation occurred way back when. Um, as I mentioned, I'm an expert because I was involved in the training so many years ago. Um, So I just want to share with you, I know it's a private matter. If there's any questions, you could feel free to reach out to me at Marianne, WNP@juvaskin.com. Thank you for your time during this presentation, and I hope to see you soon.